Hello, everyone, and wishing you a very happy Women's Day. Uh, I hope you guys can hear me. So, basically, this live session, I'm not doing the talking today. I'll, in fact, be hosting a few people who will actually discuss and talk about women's health. And I think that's one of the prime importance that we have today while we are celebrating Women's Day. I will also be taking a few questions by all our audience, whoever wants me to answer any of your questions. So, yes, I will be there to answer all your questions. And today we're going to talk about women's health. And I have two physiotherapists with me who are already working in their experienced fields and who understand and who have been working a lot about women's health, and they will be in a position to help us out uh, for the next few questions that I have for them, which I have curated and I feel that it's relevant for all our audience. So, guys, I'll be answering your questions in a while. Salman Sheikh has a question. When is your next Goa camp? I think next Goa we are in May. Okay. All right. So to start off, we'll have with us Dr. Karuna Nikam, who's a physiotherapist and who specializes in neurodevelopmental therapy and general movements, which is a exclusive field when it comes to pediatrics and pediatric therapy in physiotherapy. And I'll be inviting her to be a part of this session. So come and be live with us, and we can she can help us solve few of our questions. She can answer few of our questions. Hi, Dr. Karuna.
Hello, good evening.
I hope you can hear me.
Yes, am I audible to you?
Okay. So all right, so we would like to understand. uh,
I lost you. I can't hear you
can you hear me now? Yeah.
better.
So Dr. Karuna is experienced in her field for the last 20 years. And besides seeing patients, she's also conducting courses with a lot of physiotherapists and helping them to understand what is GM motors in basic and advanced courses. So I have a few questions about women's health, and I think what better way than physiotherapist herself talking about women's health and how things can be taken into and help them understand the importance of women health. So my first question is, what do you think is the role of physiotherapy in women's health today?
Uh, it's not about today, but physiotherapy has been an integral part of health for all. When we speak about specifically women, I would like to go a little bit back before a beautiful girl turns into woman, because today's times we are seeing teenagers walking in the clinic with concerns, with very serious concerns with their postures, with their gait, with flat feet. So we are catering not only a woman but even begins at teenage. And then yes, there are several concerns as you age. When you are in your early 30s, you need the stamina to be efficient in your professional field, and being efficient at your home. When you are touching your 40s, you need to be a bit much more stronger. So physiotherapy helps you in developing your strength, your agility, your flexibility, and it has to be a consistent routine that has to be a part of your life or your day-to-day life. It's not that physiotherapy should come into your life only when you have severe aches and pains, and when you are looking to resolve specific concerns. Yes, that time we obviously have to visit, but so that you can prevent all these injuries, how do you keep your body fit, and how do you be pain free, injury free, physiotherapy plays a very, very critical role in that, I must say.
Also, taking the next step, from physiotherapy and coming to women's health, how does exercise, on what levels does exercise play a role at different ages and different level when it comes to women?
It is a vast what would I say, um, the role of exercises for women health. And women health is not only about the physical fitness. As a woman, you are the multitasker, and you need to be fit by your physical appearance, your fitness, and most importantly your health. Exercise, we all know, plays a very crucial role in maintaining our strength. Now, when we talk about strength, I mean the bone strength. When we are doing physical activity, which is weight bearing, we are, helping our bones getting more dense and more stronger with every weight bearing exercise that we are trying to do. It could be a structured form of exercise, or even any physical activity. It could be dance, it could be Zumba, or anything where you are involving movement and you are enjoying it. It helps you, keep your bones stronger and grace fully go your 40 plus.
A lot of fitness concepts are coming into way these days. A lot of women have taken into running. A lot of people are also into fitness training or strength training all the time. So what is it like? Is it like you have to be doing only strength training, or is it like that only running is good enough? So what are your takes on this?
Well, we must understand that any when any type of a regime is trying to become an industry, it's an opportunity, right? And what we tend to forget, or the people who are trying to make it an industry, don't educate us as much. Running is wonderful, overdoing anything is wrong. Moderation is the key. you know if you are a runner but you don't have the right posture, you don't have the right form, and you continue to run, you know you can do it for your few runs, but after that your body gives up. You land up having several injuries, and they are recurrent because you are overusing certain muscles which are not receiving any training, and you are exerting them over and over and over and over again. And I would really plead to the running community, especially the women. We need to have a structured training to have running as your passion. When you're looking at having your marathons, at least I'm seeing people doing runs every now and then without having good training. It's really not a good idea.
So you're saying
There is no point in having.
basically the all the components of fitness should be taken into consideration and not
Absolutely.
just endurance
Absolutely.
or resistance training.
Absolutely, absolutely. Everything, because we are a whole body. Running is not happening from one vital part of your body. It's not a cardio only. It's not only about strength. It's not only about flexibility. It is everything optimally working together for you to efficiently run. So you need to have good flexibility. You need to have good strength. You need to have a good endurance. And yes, you need to have a good body, which can help you
Also,
sustain a run.
being a working doctor yourself, what is your message for working women, because they normally don't tend to find a lot of time. So it's like that's always a reason for them that probably they cannot work out or they cannot take care of the fitness. So how exactly can this particular thing be managed?
See, this is a real time teething issue. I mean, yes, sometimes it is always said that it's an excuse, but certainly it's not. For a woman, becoming a mother, becoming a wife, and there are a lot of changes, and these are changes which demand your physical and mental health a lot. We need to sit back and prioritize ourselves. After delivery, even I put on a lot of weight. I come with a history of an ovary being removed, and so the hormones really played very bad. But yes, I had to find it out myself what gave me joy. Primarily, I did a lot when it came to my diet point of view and the typical routine, the contemporary routine of modifying your diet, modifying your workout patterns, your walks, and everything. But what really made a change to my body was when I started incorporating dance as my, because this is my passion. So do what you enjoy the most, and you will start to see beautiful changes. But it has to be consistent. You cannot say that I know I started it, I did it for a month, and but I didn't see anything. No, for your body to reset, please understand the reset is important. It takes at least 3 to 6 months to reset, and trust me, once you reset your body, no matter, even if you go back a bit, have a little bit cheat days, it really doesn't hamper.
True that. And one last message you have for our audience,
For
all
the
of
women especially,
all our followers who are watching you.
is it for the women especially,
Yeah,
because you are calling me for the
yeah,
women?
of course, it is Women's Day, so it's
So,
always women special.
so
It
each
anyways
and
is
every
women
one.
special.
Yes. So each and one listening to me, thank you. Thank you, Dr. Sudarshan, for the opportunity. And we all need to celebrate our being. The fact that we are alive, healthy, it is enough for us to celebrate. And when it comes especially to women, my dear women, please understand your professional accolades, how good a wife or how good a mother you are, or how well educated you are not the parameters that decide what you are. It is you, your self worth, and your self respect. Keep up to your dignity and celebrate your being every day, every moment. Every day is a Women's Day for you. Celebrate yourself.
Thank you so much for joining us and spending time with our audience and helping them understand the aspects and health of women's health. And yes, thank you so much.
My pleasure. Thank you.
So now that we understood the importance of women's health, and now that we understand how exercise is important, how this health aspect is important, and how we can actually, kind of take it in such a way that it can be managed. Now, let us understand what are the problems that we face, um, when it comes to issues like, women have a lot of issues related to menstruation, whether they should exercise during menstruation. Lot of questions are there in these aspects also. So now I will invite one other another physio from my side, uh, who will be actually giving us some more insights into this aspect. All right. So let me just see. So, when we are doing a live session, the timing is very important, and it's important to actually put in a request so that, let me see, where is Doctor? Where is? Okay. So, all right. So, uh, all right. So yes, I think I have it. Yeah, yeah. So I think we'll have Dr. Nikita who will be joining us to answer our questions related to issues that we face when it comes to women health. So hi, Dr. Nikita. Thank you for
Hello, hi
joining. Can you
everyone.
hear us?
Yeah, yeah.
Yeah. So Dr. Nikita is she's a master's in musculoskeletal therapy, and she has a 3.5 years of experience, and she's been working with joints in motion. And yes, Dr. Nikita, we have a few questions for you to understand, the issues that women face, when it comes to managing their health or maintaining their health, and how these issues can be solved. So firstly, what I would like to know is, what exactly is this female athlete triad? Can you just put some light on that?
So, female athlete triad is a very common issue nowadays with a lot of young adolescent girls who are a lot into sports, and I think it is not talked about a lot. So nowadays there are many girls who are really into sports and are focusing on one sport particularly, and maybe they have some kind of pressure to perform good in their sport and to look a certain way, like look very athletic. In that pursuit, they actually reduce their calorie intake a lot and overtrain, because they just think that if they train enough, they'll be superb in the sport.
And especially this is a
So, but
growing age.
yeah,
Yeah.
so they think that it is completely in their control. But it is worth noting that because these people reduce the calorie intake a lot, it actually reduces the estrogen production in your body. So, what is estrogen? Estrogen is a hormone which is responsible for calcium absorption in your bones. So these girls end up having like mysterious hairline fractures, vague hairline fractures in their body.
Yes.
And when they come to us, it's a mystery because there is no history of trauma, there is nothing. And when we investigate further, we come to know that these girls are actually overtraining, not eating much. They have some eating disorders. So it's very, very important to talk about it right now, because the cause of this problem is lack of professional help. If if people actually consult a qualified physiotherapist or a qualified coach who has done some accredited program internationally, or a physiotherapist actually, so these problem can really be tackled. These females end up having a lot of hormonal issues later on in their life with body image problems.
In fact, one thing that I have also seen is that a lot of these people also have, even in their 30s and 40s, when women take up with fitness on a regular basis, and if they are pushing this too hard, they also end up with a lot of stress fractures. Because
Yeah.
if a similar kind of, like for example, if you're looking at only endurance, or if you're looking only at flexibility, you also end up with stress fractures, which has been very common in adolescents, as well
Yeah.
as it's also common in these people who are between the 30s to 40s. Yeah. Right. And how do you think exercise helps with mood disruption, when it comes to menopause? Because menopause is a one very talked about topic. I see a lot of patients themselves, and they already come with a mindset when it comes to their age, and they already take up that sort all kind of symptoms already, that I'm reaching close to menopause, and so these are the issues that I have. So how much do you think these exercises will help with this mood disruption of menopause?
So a lot of female in that age category are actually suffering from depression. And instead of in that age group, you already tend to gain some amount of weight due to hormonal
Yeah.
issues. And if you tend to go towards antidepressants or anti-anxiety medications, you will end up getting a lot more obese. So
Right.
exercise is known as a natural mood booster, as it is. So exercise will actually improve the endorphin levels in your body,
Yeah.
which will end up regulating your hormones. So exercise is the only thing which can help in
And
that
do you
time.
also think that the mindset also plays a very important role? Because the more you read about from internet, from Google, from all other places, and even if you don't have a symptom really, you come up with more symptoms as you are nearing to menopause. So do you think that mindset also plays an important role?
Definitely, because some women feel misunderstood as it is during in that
Yeah.
age, in the fourth decade of their life. So apart from physical activity, it's very important to actually listen to them, which a healthcare professional will aid in. The healthcare care professional knows the issues faced by these females and the importance of actually listening to them.
And one question that typically a lot of women tend to, get confused about, especially who are being regularly with exercises or any kind of exercise format. But do you think it is important, or should you exercise during menstruation?
It is a very controversial topic. Some females, like majority of the females, have a perception that if you are menstruating, you should just rest and stop all activity,
Right.
which is not true entirely. Engaging in some form of physical activity, it will act as a natural pain reliever, and it will actually reduce muscle cramps, abdominal cramps to a very large extent. Since the blood supply to that area will increase, the oxygen content will be more towards these muscles. So the cramps, it is shown in many studies that the cramps actually reduce by 80% if you engage in some activity. But moreover, it is also necessary to not indulge in very heavy strength training or long, intense cardio sessions. So there is a line there, but definitely you should indulge in mild form of stretching, yoga, and mild cardio exercises.
All right. Perfect. So I think that gives us quite a bit of glimpse into, the exercise part of it and what are the complications and how this can be managed. Any message that you have as a young physiotherapist to all our audience?
So the message to all the females from my side would be, like you take care of everyone in your life, you should also take care of yourself. And you're really taking care of yourself means actually consulting some healthcare professional and not indulging in trends or some workout you have seen in on Instagram reel, or some workout you have seen on Facebook. Someone told you something. You should actually genuinely search for the right information and consult a healthcare professional to take care of yourself first. Then only you can take care of people around you.
Perfect. Thank you so much, Dr. Nikita, for joining in and sparing your valuable time. And it was quite an insight from you also. And it was wonderful talking to you. And thank you. Thank you so much.
Welcome.
Okay, so friends, that was Dr. Karuna and Dr. Nikita who were talking about different aspects of fitness and health and how things have to be managed in certain conditions, why fitness is so important, why exercise is so important for women. And now I'll be taking up a few questions. Let me check if we have any questions now. Uh, well. Uh, Yeah, one question was when I was in Goa. I told you that I'm in May, so you can connect us. Not May, sorry, we are in April. In Goa, we are in April. Yes, so we can connect in April, definitely. Yeah, so I think we don't have any questions, but in case all the people who are watching this video, we are doing a live session, of course, and whenever you watch this video, if you have any questions, you can still put in these questions in your in a message, and we can definitely reply to it or consider these questions in the next live session. So thank you so much for joining in, and have a lovely evening. Once again, a happy Women's Day to all of you.